Advanced Medical Transport, this is Kim. Can I help you?
AMT ambulances are an extension of the emergency room. We have highly trained staff, as well as that expensive equipment. In fact, that's the highest cost of delivering health care is via a 911 EMS call and transport to the emergency room.
We are early innovators. This is the ultimate final safety net for those that need care coordination, and all efforts have failed. Community paramedicine is a complete reversal of what traditional EMS does.
It's a very creative, innovative idea to meet some of the needs of our patients in the community.
We are trying to keep people out of the hospital and healthy in the communities, and we face penalties for hospital readmissions. We have case managers, we have home health, and we have a variety of ways to deal with this. But there are a few patients that fall between all the cracks, and that's where this program helps.
Mobile integrated healthcare system attempts to utilize existing resources to do a better job of providing healthcare services so that we really embrace a triple aim in terms of our focus of improving the health of vulnerable populations, improving the healthcare experience for the patient, as well as reducing healthcare costs per capita.
We, for many years, have had the same choices as far as visiting nurses, seeing patients, but you have to qualify, you have to have a payer source, you have to have a doctor willing to order it, when really a lot of these high-risk patients that we meet need to have someone just checking on them quickly after discharge to ensure they have the medications they need, tie up any loose ends, ask any questions that are maybe lingering out there that may cause them to come back to the hospital.
Two of the big things that the hospital wants to know are, have they followed up with their doctor? Have they made an appointment at all? Or have they already seen them, or do they need help making an appointment? When I'm done with that, then the next big thing is, do they have their medications? If they do have their medications, are they taking them like they're supposed to?
It's kind of surprising the number of patients who go home that just don't pick up their meds. It's not because of a financial barrier or a lack of understanding. It's just they don't have the resource to be able to maybe go get them even, or someone to go drive them to the pharmacy. So that's a really key piece.
Additionally, the opportunity that mobile integrated healthcare provides is bringing trained paramedic staff into the home to not only assess the health of the individual, but also assess what other potential issues are creating challenges for that individual to follow the healthcare protocol that they've been tasked with from their discharge physician.
Many times when a patient comes in the hospital, we have to believe what the patient tells us. And many times the story they tell us is not necessarily the most truthful story or the most accurate story. So by getting AMT in to do an actual reviewing of the bottles of medications to see what meds are they truly taking and how does that mesh with the recommendation for the medications that we have at discharge.
The feedback from the patients have been very positive. This is a new experience for a number of them in terms of having someone with this type of skill set and positive demeanor coming into their home and interested in their well-being and interested in those other issues that affect their well-being.
And what's really been a pleasant surprise is that the patients welcome it, and we have data to show it's making a difference. Our hospital readmissions for patients who have received paramedicine wellness checks are less than those patients who go home without it. We created a very unique relationship with AMT, and I could tell very early on that they were innovators. We'll have the trained eyes and ears of the AMT experts to evaluate this patient.
That's why we kind of sit in a very unique point.
It's an optimal use of resources in terms of investment prior to the need to call 911 and be transported to an emergency room. So that's why we're so enthusiastic about this opportunity in terms of delivering this type of service.
So we have a very unique, close, highly productive working relationship. And through this, we've been able to small test this innovation to see if it works. And we're now coming forth with the results of this program because we feel it is reducing our readmission rates and it is improving the health of the populations that we serve. And it is making a difference for a very, very difficult population in regards to their overall well-being.
The future of this effort will be dependent on our ability to engage community health providers and health system stakeholders, which are essential for the success of a mobile integrated healthcare partnership. AMT's ultimate goal of this program is to reduce demand for emergency and acute care services by creating a system of care that focuses on prevention and a more appropriate and less costly venue for delivery of that care. The Wellness Visit project is a start in developing the type of innovative programs that can improve the overall health of our community.
Oh, I think it's the best thing. I think getting in a patient's home is truly how you understand what is going on in that patient's medical life, their psychosocial life. When we see them, they're all in a hospital gown, they all look the same in a bed, but to see them in their own environment, to know how they're interacting with others is the future of healthcare.
It's a new way of thinking on how we need to provide healthcare as opposed to being concerned about episodical events. We're now worried about how do we maintain a healthier community.